which is the paper on prioritising patients in every decision we take. I should, and I apologise at the outset, have attended the apologies of Tim Kelsey, whose paper it is, but who's not able to be with us today. But Bill McCarthy is going to introduce the paper. Bill.
Thank you, Chairman. Now, this report steps out, I think, some of the practical steps that we're taking to make our commitment around involving patients in every decision we take, putting at the heart of all we do, putting that into practice. The paper covers a whole range of activities, some of which we've discussed before at the board, so I don't intend to take you through paragraph by paragraph, but I would pick out, I think, two important areas. The first is around patient and public involvement in specialised commissioning. This is covered in paragraphs 16 and 17. You'll recall, Chairman, that in our readiness for the financial year just started, we had to undertake a pretty rapid process of preparing for specialised commissioning. And I think we were understandably criticised for the degree to which we could really involve patients and the public during that pretty short period. And I think it was fair and justified comments that were made to us. We think it's really important that we draw from that and start working now to put into place much fuller, more comprehensive arrangements for the following year. And those commitments now are set out in paragraph 17 to respond to what I think were some fair points that were made to us. The other area I want to draw out is right at the start of the paper, and it's in paragraphs 2 and 3, around widening digital participation for all. This is, at this stage, a relatively contained project, but I think quite an important one. We've talked at the board about our view that digital channels of communication are going to be increasingly important, both for empowering patients, involving patients, as well as for giving out the right sort of information and support to patients. It's therefore important for us that we ensure that is a channel of communication that can be available to as many people and different parts of our communities as possible. And we know that there are some parts of our communities who have poorer access to digital communications than others. This project is about tackling that and working with the Foundation in partnership to provide areas, provide access to groups who could be disadvantaged to digital communication. So I just wanted to highlight that, because it goes with another of our commitments about equality and fairness for all. The only other thing I'd say is that Victor or Kieran may want to talk briefly about the piece of work they're leading around the Civil Society Assembly that we mentioned at the last board. But with those 3 points, Chairman, I'd ask the board to note the report.
Thank you, Bill. Victor, you had an invitation, and Kieran.
So myself and Kieran have got started on this idea of building what has been in very, very draft terms called the Civil Citizen and Community Engagement. I have to say that we have taken I've taken the view that we need to progress this in a sort of mode of respectful inquiry. And the reason for that is that there are lots of organisations out there that would perceive that they do some of this. So we have had discussions, we've started to have discussions with organisations like Health Watch, for instance, who were launched yesterday, and others, National Voices, and many other not-for-profit groups. We are in the process of establishing a steering group. We have a sort of staff support set up, but I think the design of this is really, really important, because if we get it right, then we start to describe what a health and social care movement looks like and what it can do. And that relates to the point that David made about, we were discussing about the Constitution. If we get it wrong, then we look a bit like the René Magritte painting when the guy looks in the mirror and sees the back of his head. And we need to be really clear that in the way we do this, it is honest and transparent, and that we're able to react to what we see. Now, that's a big promise we're making. So our process, I think, has to be really carefully managed and carefully led, and for which I'm very grateful for Kieran's support in taking on, putting his name to this as well.
Kieran, do you want to add to that?
No, not hugely. But can I talk about one or two of the others? I think it's great that there's a response to criticism and engagement with specialised services, and I think it's back to the principle. If we're going to do something like this, responding to what we hear is important. So, commend that. Another small comment around Friends and Family Test. One of the things that doesn't quite come across from the paper is there's a lot of other work going on as well about how do you respond to the Friends and Family Test. That just tells you have a problem potentially, doesn't tell you what to do about it. So Tim is working with a number of people, including us, on that kind of aspect as well, around saying if I do pick up something, what was good quality experience and what's the intervention which will improve it.
Thank you. I have Ed and Margaret.
Just a point on paragraph 7 and the Insight dashboard. I think it would be helpful in the light of the earlier discussion to ensure that the executive have their own assurance and can assure the board not just about the full functionality and publicly availability of it, but the resilience of that system. And I would much rather us be very comfortable with its resilience than run ahead of ourselves on that. So I just think that
it's worth noting. Thank you. Margaret.
Prioritising patients in every decision we make is such a great title and such a great objective. And I think that the Friends and Family Test, as it rolls out, is going to be a really good way of understanding whether in fact we're actually achieving our objective. I do feel though that the Friends and Family Test needs to be underscored, and I've said this before and I will keep on saying it, to be underscored by our understanding of how staff feel in the implementation of everything that they need to do. We can't always focus on the end game without understanding how we're going to get there. If staff are not happy, if staff are not feeling listened to, if staff are not feeling fulfilled, no matter how hard we ask ourselves whether the Friends and Family Test is a good test, the objective won't be achieved. We will achieve the objectives much more readily if we're asking ourselves not to have the Friends and Family Test as a totem, a single totem. I just feel that you can move from a target totem to a Friends and Family Test totem and forget everything else that's attached to it. But we can see that if you have the targets as a totem, care and compassion could be something, and we've already learned, that gets put to one side inadvertently. So what I'm saying is we need to be much more circumspect, and as part of that circumspection is really saying, when we ask questions of staff, it's not just would you recommend this to your friends and family, it's also, are you happy in what you're doing? Do you feel you're being listened to? Do you feel your line manager is supportive of you? Does your line manager have enough time to listen to you, to help you with your performance? Are other people who are not actually helping you to achieve the outcomes that we want being properly performance managed, and all the other aspects that are attached to, are we listening to staff to achieve that objective, I think are critical. So I think what I'm saying is let's not be too totemic about the Friends and Family Test.
Yeah. Victor, I think you wanted to come in.
I'm just going to add to that really, but I think it's not an either or, it's an and I just wanted to add the and bit is two little bits, clues as to what's possible. One is the 6 C's, which I think is actually, from what I've observed, they've really released some energy out there for a positive shift. And the other is the NHS Change Day, which I thought was incredibly powerful in moving, in creating a sense of possible. And I think that's really important. And if you add that to what Margaret's just said, you start to create conditions in which we can really start to work with staff and patients, consumers, as opposed to for, or even indeed against. So I think there's something really positive out there. You know, the NHS Change Day we should take, I think the 6 Cs we should take, you know, they are clues to what this could look like. Yeah, really good stuff, I thought.
Good, thank you. David?
Can I just, I mean, I absolutely agree with you, Margaret, and in a sense, we'll be coming on to this when we talk about the business plan. Because in our conversation, if you look in terms of the business plan, the headline is kind of happy patients, happy staff. You know, they do go together, and it's even more important than you identified that it was. It's even more because what it does. If you look at the research around this that we've been looking at ourselves, is that staff that are engaged, that feel they're supported, that they work as a team, all of those things improves mortality. It actually saves lives, and there's really strong evidence that it's a bigger determinant to saving lives than, for example, the number of doctors that you have. You know, it is that important, and that's why I think we've headlined it so much in relation to the business plan. And I think you're absolutely right to make the point. Those two things do go to hand. And again, you don't generate the kind of supported staff by just talking about inspection. You talk about inspiring people. That's why the 6 Cs are so important for us. And I think the Change Day was very, very interesting. If you think, I mean, for those of you who don't, I'm sure many of you do, but it started off by a couple of junior doctors talking together, saying, junior doctors complain and moan about things. Wouldn't it be good if every junior doctor did something positive about improving quality on a particular day? And that grew and grew and grew, so that on the day 182,000 people signed up. There was no target, there was no national, you know, it grew bottom up. In fact, there was 11,500 people in Northern Ireland who weren't even part of it signed up. You know, so it just shows you there that if you just get the thing right, if you give the right support, how you can unleash this huge amount of talent, energy, and enthusiasm to improve services for patients. And a really, really good example.
Good. Well, thank you. On that note, I propose that we note the report. Thank you very much, Bill.